Good afternoon. I'm Joanne Starks of SEDL, or CEDL, in Austin, Texas, and I'll be moderating today's webcast entitled Guideposts for Success to Support Employment Transition for Youth with Disabilities, Research, Policy, and Vocational Rehabilitation Practice. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, KTDRR, which is funded by the National Institute on Disability and Rehabilitation Research, or NIDR. The Center on KTDRR has a subgrant with the American Institutes for Research, AIR, to develop a series of webcasts and to establish a community of practice to help promote the understanding and use of evidence-based practices in the field of vocational rehabilitation, or VR. Cindy Kai is the manager, and she and her colleagues, Anastine Hector Mason, Emma Hinkins, and Prokisha Mather, have been instrumental in the development of this webcast and related community of practice. I also want to thank Ann Williams, my colleague at KTDRR, for her support for today's webcast. Here is our agenda for today. After an overview of the webcast topic, I will introduce our presenters, and we'll have a facilitated discussion. We'll then wrap up by letting you know how to become part of this discussion. In the first webcast, we discussed the issues surrounding the use of practice guidelines in the VR field. The most recent webcast focused on the evidence-based practice of motivational interviewing. In today's webcast, we will follow the same thread by translating research to inform VR service delivery. We will have a dialogue with a researcher, a policymaker, and a VR practitioner to discuss the research, policy, and practice surrounding the use of guideposts for success to support the employment transition of youth with disabilities. In our dialogue today, we will discuss 5 central questions. What is the research and its evidence base for guideposts for success, or guideposts, to support the employment transition for youth with disabilities? What does research say about the key issues that VR practitioners should consider when implementing guideposts for transition youth with disabilities? What are the federal and state level policies surrounding the research and implementation of guideposts for success for transition youth with disabilities? What are some of the VR practices related to guideposts? And what is the role of practice guidelines in supporting VR practitioners to implement guideposts with transition youth with disabilities? We are happy to have 3 panelists with us today, and I'd like to give a general introduction. Richard Luking is president of Transcend Incorporated, a nonprofit organization dedicated to improving employment success of people with disabilities, and he's co-principal investigator for the National Center on Transition to Employment for Youth with Disabilities. Next will be Curtis Richards, director of the National Collaborative on Workforce and Disability for Youth at the Institute for Educational Leadership. And Laura Spears is the Transition Services Coordinator at the South Carolina Vocational Rehabilitation Department. She chairs the South Carolina Youth Leadership Forum and the Transition Alliance of South Carolina. Now I'm going to turn to Dr. Richard Luking to ask him to comment on the literature base about guideposts for success to support employment of transition youth with disabilities to address the following questions. How does literature define the guidepost for success model, and what are the core components or principles? How does the literature define transition youth? What does the literature say about the evidence base for the Guideposts for Success model? And what are some key features of the literature that are directly related to what VR practitioners need to know and do to assist transition youth with disabilities who may benefit from the Guideposts for Success model? Are you ready?
Yes. Yes, thank you, Joanne. Each of those questions is worthy of quite a long discussion, and we have a limited time here to cover them. So what I will try to do is present the information in a relatively brief and hopefully digestible way so that folks listening can get a snapshot about some of the important aspects of the questions you ask. So let me start with the Guideposts for Success themselves. Now, for those of you who aren't familiar with them, they were first published by the National Collaborative for Workforce and Disability for Youth with Disabilities in 2005. As Curtis Richards will say later in this broadcast, they are undergoing some revisions. Um, but they're still very relevant to practice today. And at the time, in 2005, the guideposts were based on what we all knew in the field to be those components of transition service and service to youth that will most likely lead to successful post-school outcomes for these youth. And so based on extant research of the time, as I will talk about a little bit later, as is being reinforced by current research, these 5 components make up the guideposts, and each of them in their own way have influence into how well youth proceed from transitioning from school into the world of adult life. So I'll summarize each of them briefly, and then what I will do is I'm going to give you a picture of each of them so that you understand, you can put a face to and an activity to what each of these things means, and hopefully that will introduce the value of the guideposts. But just quickly, they include school-based preparatory experiences. Those are those experiences that ordinarily a youth receives when they go to school, their academic curriculum, and those activities in school that will lead them to a career of some sort. And then the next one would be career preparation and work-based learning experiences. That is those kinds of activities that expose youth to the world of work so they can make decisions about what they can do, what they like to do, what they're interested in doing. And also when they're paired with their academic instruction, they're particularly powerful. And just one side note about this, work-based experiences during the secondary school years for youth with disabilities, particularly paid work experiences, are the single most strong predictor of post-school employment success. I'll have more to say about that later, but that's a very critical piece of this. Youth development and leadership is a third guidepost, which which deals with the ability of youth to make their own decisions and to direct their own course of their career development and have input, not just input into, but also actively participate in where their career goes. And then with that, connecting activities, that is those kinds of activities that enable those organizations that may touch the youth's lives to work in collaboration with one another to make sure that there is as seamless as possible transition from one support service to another, from school to, particularly in light of this conversation, vocational rehabilitation partners, and any other service that might be important in supporting that youth's transition. And then the fifth guidepost is family involvement and supports. Again, research has shown when the guideposts were developed and continue to show that those families who have high expectations of their family members with disabilities are going to be important influencers in the lives of these youth as they're making the transition. And since they know these youth the best, they're the ones who can provide important guidance to their career development. So let me talk about each of these in the context, just to give you kind of put a face to them. The first picture here that I have is a young man sitting behind a desk, typing on a laptop computer. And this is an illustration of how important academic preparation and work is to developing careers for young people with disabilities. This young man's name is Philip. He is studying to be a graphic designer, and currently he's enrolled in a community college to pursue an associate degree in that area. Now, he came to this because when he was in high school, he took some graphic arts courses, and he also had work experiences that exposed him to workplaces where those skills were important. And so that led him to pursue this post-secondary education curriculum for that purpose. It's important to note, though, that Philip was on the verge of dropping out of school because of various problems he had at school in terms of his attendance, his behavior. He would often get in fights with other students, and he was very close to just dropping out of school, if not being expelled even. And his ability to link his academic preparation with his interests and have work experiences that made that happen for him kept him involved and engaged, and his story is turning out to be a very positive one as a result. But the whole idea of school-based preparatory experiences that lead to specific careers is illustrated by his example. The next slide is a young lady named Kendall. In this picture, she's sitting in her wheelchair holding up her Employee of the Month certificate with her coworker standing behind her. The reason why we're using her to illustrate youth empowerment is because during the course of her in transition planning and her IEP, she participated very directly and made it a major point to her teachers and those people who supported her that she was very interested in being with people in a workplace where other people were friendly and engaging and where she could engage with them. And despite the a communications disability, she really wanted to be in a position where she could communicate with people on a regular basis, which led to her job, current job at a hospital in Baltimore, Maryland, where she works in the telecommunications department, not communicating directly with customers, but supporting the women and her coworkers who are standing behind her in this picture, delivering documents and otherwise generally supporting their work. So without her speaking her voice and being able to communicate what she wanted to do and the kinds of environments she wanted to work in, she would not have made it to that place. So that's the guidepost on youth, an illustration of the guidepost on youth and career development. The next slide is a young lady who's working at the Department of Corrections. You see her in a picture with working in the mailroom of, actually in the vernacular, it's a jail where she works, and a coworker standing behind her or working with her with a uniformed officer that works there. She was connected to this job experience by a vocational rehabilitation counselor and the community rehabilitation provider vendor who worked with her to help her find this job. Prior to her exit from school, while she was still a secondary education student, she got this job via these connections and working together with the teacher in her class to make this happen. Another illustration of the importance of those kinds of connections and that guidepost. The next picture is a young man standing in front of a whole rack of files. In this picture, and at the time it was taken, he was working at a dentist's office as a work experience while he was in school. He's currently working a full-time job with benefits with the Department of Veterans Affairs in Washington, D.C. But one of the major reasons he got to this point was because his family absolutely expected him to have a paid job as a result and a culmination of his special education experience. And so they advocated for that to happen, and along with Ramon. And so with their support, he has been able to have his career successfully proceed. Now, I should also say that each of these individuals that I've presented here, with the exception of Philip, who's still in his education program, have all been examples of successful rehabilitation closures because the vocational rehabilitation counselors who worked with them were able to close them successfully because of the work experience and jobs they obtained as a result. So the next slide is a young lady named Tamika, who in this picture is working in her job in an inventory area in the U.S. Department of Agriculture. She illustrates the thing I was saying earlier about the importance of work experience and paid jobs as part of their secondary school career, because she had this job while she was in school, and she still has it. And finally, this last picture is a young lady named Kirsten who works at the U.S. Consumer Product Safety Commission. She is, in this picture, she's operating a jig that helps her align documents that go into a file with a two-hole puncher. She needs the jig because she's totally blind and needs that accommodation. She also has a learning disability, and But for her, as with the other individuals that I discussed briefly, she has this job because this was a job that not only did she have when she was still a student and kept as she transitioned to her adult life, but she has kept it for the last 22 years. So what I'm talking about is nothing new necessarily, but we're having more and more we have more and more research that supports the importance of this kind of activity in all of the guideposts. So quickly, because we want to make sure we have plenty of time for our discussion with all of the presenters, one of the questions I was asked was, what is a common definition for transitioning youth? And there are different definitions based on the different laws that may apply. On this slide, it shows that by the Individuals with Disabilities Education Act, transition planning begins at age 16 and continues through their exit from school or at age 21, whichever comes later, whichever comes earlier, I should say. But in the context of VR, the most useful way, which I'll explain in a minute based on the research, for VR to consider transitioning youth is that begin service 2 years prior to projected school exit is a way to think about how to serve youth, and so early case initiation for VR services is the context here, and to continue service post-school until case closure. In other words, the age is less important than the stage at which they're transitioning. So if VR services are able to begin prior to school exit and continue until they no longer need it and they successfully proceed into their careers, then that's what the definition of youth is best defined as. So the research, quickly, there are two major pieces of research that focused on the guidepost, both of which are available now. And at the end of this session, when I give my contact information, I can tell you how to get these. But there was one study called the National Youth Transition Demonstration where youth who were on SSI were provided a specific intervention based on the guideposts. And youth who received this intervention were much more likely to have employment 3 years after they received the intervention than the youth who did not. Again, supporting the efficacy of the guidepost as a transition framework. And then also recently, the Maryland Vocational Rehabilitation Agency, the Maryland Division of Rehabilitation Services, or DOORS, recently completed a 5-year demonstration project in which youth exited school with employment and or post-secondary education enrollment in place as a result of an intervention that featured the guideposts that I just described. Both of those research documents are available for review, but they both support the efficacy of the guideposts as a framework for transition. So just to summarize what this means for practice and vocational rehabilitation, in its most, I guess, straightforward way, these are 4 things we can say with confidence. First of all, that early case initiation, as I mentioned before, ideally 2 years prior to projected school exit, results in higher rates of successful case closures. So as a vocational rehabilitation practitioner, that's important to know because even though I may not be paying for services that much prior to school exit, that early collaboration makes transition to employment much more likely. We also know that collaboration with education and other community partners, including VR, equals higher rates of successful case closures. We've recently conducted a study where collaborators who are focused on the outcome of a particular youth, as opposed to simply handing off service activity, but actually jointly working together for a common employment outcome, very high success rates of case closures. And of course, what I said earlier, work and job experience prior to school exit is the most significant predictor of post-school employment for youth with disabilities. And so to the extent that VR can work with schools to make that happen, the more likely these youth are going to be able to work, and the more likely that VR will be able to gain successful case closures. And then finally, it's important that the research also said that we shouldn't be satisfied with just any job, but that it should be jobs that are jobs that youth, as in the case of Kendall that I talked about, want and match their aspirations and their interests and so forth. Jobs that their families are able and willing to support. Where that happens, there's going to be not only better job matches but longer job tenure. So there's research that supports all of this, but I'm just summarizing it for the purposes of this recorded broadcast. So I'll stop there and pass it over to the next presenter who can elaborate on what are some of the policy implications of this.
Well, thank you very much, Richard. Now we're going to turn to Curtis Richards, who will comment on those policy issues surrounding Guideposts for Success and address the following questions. What are some key policies that shape the employment for transition youth with disabilities? Are there significant differences or significant similarities in policies across states? What is the policy implication of the research on Guideposts for Success? What needs to be done for Guideposts for Success or similar models to have stronger impacts on federal and state policy to shape VR practice for youth with disabilities? And finally, what advice do you have for VR practitioners when implementing policies related to Guideposts for Success or similar models? Curtis, are you ready to go?
I sure am. Thank you very much, Joanne, and thank you, Rich. Nice job setting the stage. So in the interest of full disclosure, I first of all want to say that I'm a product of special education and a product of the vocational rehabilitation system. I have a visual impairment and am using a document reader, screen enlarger, so I may be a little bit slower in moving my slides along, but I'm independent enough. I want to try to make this work, so hopefully we can make this happen. In terms of policy, I want to start with, when we here at the National Collaborative on Workforce and Disability for Youth talk about policy, it all starts in what's in statute, what's in law, what's in regulations, what's in federal law regs, what's in state law regs, what are then the directives that come out from the various agencies, and so that you can't really have this conversation without trying to have a little bit better understanding of what's been built into laws. That said, I want to say that we also believe that we do not have a coherent policy around transition in this country. What we have is several different laws, and I'm going to walk through them a little bit here, at least to hit the highlights. We have several different laws, some of which connect, some of which don't connect, which can make transition policy a little bit confusing. So the first place we start would be with the Special Education Law, which is the Individuals with Disabilities Education Act. And you heard a little bit about this from Rich in terms of the age issue, but the way we like to talk about it is you have a whole lot of stuff in the front end of IDEA that says that you need to be doing work around helping young people transition, get them to be moving toward additional education, toward community living, toward work, toward supported employment, other kinds of training, etc. So on the front end, you could sort of have the goal of what you're supposed to be doing. Then you also have some processes that are built into the federal law. That is to say, the individual education program in the transition piece of that IEP that's supposed to help drive the planning process for transition. You have due process issues that youth and families are supposed to go through. You have youth that are supposed to help guide their own transition planning process, right? So you have some clear processes built into the statute, and you certainly have this age issue. In which, according to the federal law, transition planning is to begin not later than the 16th birthday of the young person. And then on the back end, you have now some efforts to try to hold schools and states accountable for doing transition planning in terms of indicators, some of the performance indicators that have been put in place. Indicator 13, which is a process indicator around transition planning, and then indicator 14, really, which is about trying to figure out what the post-school outcomes are. What you don't have in the federal law is what needs to occur in the middle, what occurs during the school day or the school year around transition. I like to talk about it as the content of transition. We don't really have a conversation about the content of transition in IDEA. So another federal law that comes into play here, and Rich's slide earlier mentioned this as well, is the Workforce Investment Act. The WIA has just been reauthorized a few months ago. Folks are still trying to pick it apart and figure out what it is that's needed to be done and how it all fits. But the new law, which is called the Workforce Innovation and Opportunities Act, has Title I, which zeroes in on youth services and adult services, and this is important for the vocational rehabilitation system to get a better understanding of for several reasons. And it also contains Title IV, which is the vocational rehabilitation law that we're going to talk about in the next slide. But in Title I, what's really important for folks in the VR system to understand is that there is an increased emphasis now on serving out-of-school youth. That is to say, 75% of the funds for youth programming that comes through WIA dollars is to be used for folks who are out-of-school youth. And there's a whole definitional issue around what out-of-school youth means, but one of the subset pieces of that definition is youth with disabilities. So here's another population. These are folks that have likely been pushed out of school who are going to have some disabilities that are going to be folks that rehab should be tapping into and helping serve. Two other issues. One is that there's also a big emphasis now in Title I, and actually throughout the entire law, that really talks about the importance of and emphasizes career planning, career pathways, career development issues across the board. This is for youth and for adults. It's also woven into the voc rehab language that we'll see in a little bit. Rich made a couple of points about the importance of work-based learning experiences. That too is now built into what's required of folks in the youth programming area. So folks in the local areas are supposed to be spending up to 20% of their funds to make sure that young people, these out-of-school young people particularly, are getting opportunities to work. Title I also has a couple more things relative to folks with disabilities. It has a lot stronger language around non-discrimination and the need to be able to provide physical and programmatic access in our Career One-Stops, also called America's Job Centers. And there's a new twist here, and this is really important for voc rehab and their clients and their constituents to understand, is that there's now a requirement that the local workforce boards can establish disability advisory committees to help them understand the issues around disability accessibility, disability programming, physical accessibility, programmatic accessibility, communications accessibility, etc. So these advisory boards, which is new, present some nice promise for folks in the disability community, and hopefully the voc rehab people can help play a role in making those happen inside of workforce boards. So let's then zero in on Title IV, which is, as I said, the vocational rehabilitation authorizing statute. There are a number of things here. First of all, there is no age issue that's built in, unlike IDEA. Remember, in special ed, I said no later than 16. In voc rehab, there is no age restriction or age issue. One of the main set of things that voc rehab can pay for, obviously, are transition services. In the new law, there is a very strong and renewed emphasis on being able to move people, youth and adults, into competitive integrated employment, and more on that in just a second here. But there's now also a very strong emphasis in the statute on voc rehab placing an emphasis on serving transition age youth. Literally a requirement now that at least 15% of the funds have to be used to serve transition age youth. That there needs to be increased opportunities, once again, emphasis on exploring and practicing work-based learning experiences as a way to be able to get folks ready to move into work, emphasis on career development and planning, again, in the rehab statute. And then there's in addition to that, there's requirement now in the rehab portion of the law that the states can make services of transition age youth a high priority when and if there are tight resources. Then, as a result of a lot of conversation that's been going on, we have way too many schools in this country that are helping run what we call sheltered workshops at sub-minimum wage, either running them or moving young people from the transition age youth, and we're particularly talking about folks who are the most significantly disabled. We have a lot of folks that are still being moved into those sub-minimum wage jobs in sheltered workshops. So the new statute has a whole section that is designed to discourage any of that sort of activity, moving young people into those sheltered workshops, and it does so by really getting very specific, and I've only given you the highlight here, very specific, laying out the sorts of pre-employment services, transition services that VR is supposed to be helping young people get as a way to avoid moving into the workshop. And those pre-employment services include all kinds of stuff around self-exploration issues, career exploration issues, career planning and management issues. So you're going to hear a lot more about this. As I said, this law has just been put in place. We're now moving into the regulation making process. There's going to be a lot of discussion and training going on about what these particular provisions mean. But what you need to know is it's pre-employment work, and it is really designed to keep folks from moving into sheltered workshops. So enough about sort of the federal overlay. What about state and local overlay, right? When you talk about state laws, what's occurring in terms of state laws, and what are the kinds of issues that we certainly have seen crop up. And the way I like to talk about this is, you have a lot of state level statutes that are designed to most of them are designed to really connect with, align with, clarify on some levels, particularly the issues around implementing the special ed law, and one that really always stands out is the age alignment. Remember, I said that the IDEA says not later than 16. Well, a whole bunch of states already had on their statutes that transition planning would start at 14. Probably a whole bunch of states actually changed their laws not so long ago to bring that to align up to not later than 16. But a lot of states left 14 as the age. Some are even younger than that, because all the research, and Rich can verify this, tells you that you need to be in there planning as soon as possible. And the federal regulations around VR say exactly that. No age issue, as soon as possible. We've also seen a number of states, we probably have, 37, 38 states in this country now, that are requiring something called an individualized learning plan, where school folks are being required, largely in high school, some middle school, are being required to do some planning for what they're going to do post-school, whether it's going on to college in some level or going on to work. And so they have these individual learning plan requirements to set goals and keep track of everything and grow it. So we have states that have have connections between these ILP requirements for all kids, including kids with disabilities, and what's supposed to be happening with their IEPs, with their individual education programs. We have a couple of states that actually exempt students from having to do, students with disabilities from having to do the ILPs because they have the IEPs, which we frankly don't happen to think is good public policy. So you're going to want to get a little better grounded in your state level ILP requirements, because how that then connects to your individual plan for employment also makes a difference, because you're already going to have a whole lot of documentation already there. Another way to think about state level policy is, you know, you have a new state leader, you have an agency leader that comes on, and there's certain activities that person wants to initiate. We've seen a number of grant opportunities from the federal government and states jumping on this. Particularly these two that I list here, Rich already mentioned one, but these are related mostly to working with young people who are in Social Security and trying to help them transition successfully so as to get off of Social Security. Then we also have a number of states that have these what we call interagency collaborations. One of the things that VR is able to do, and a handful of states have figured this out and are doing it really, really well. A bunch of other states are still trying to figure out how to do it. Is to establish formal agreements with the education department, the education agency, so that they use education dollars, local, state level education dollars, to match their vocational rehabilitation dollars to create these cooperative agreements to help serve transition age youth. The one that really stands out is in the state of California, where they have the Workability One program, which a year and a half ago, no, 2 years ago, we're in November now, aren't we? So 2 years ago, they realigned their entire workability programs, the cooperative agreement, to be consistent with the guideposts. So the guideposts set the framework for what that workability program is all about. And then you have other policy-related issues that we like to talk about. One of them is just pure culture and myth. A lot of times people think that there's a policy, or they'll tell you at the local level that there's a policy that you can't serve anybody from VR until they're graduating high school, the senior semester of high school. And that tends to be more either some kind of a culture that grew up there in the agency or in the area, or some sort of myth, and largely driven by resources, right? Because at some point, you know, the resources are thin, and so you do obviously get a lot of policy at the state and local level driven by the availability of dollars. Speaking of which, as you know, when we look to see what are the differences and what are the similarities amongst the states as it relates to policy, I think I already mentioned the age alignment issue, particularly around IDEA. There is, again, this issue about when can VR come into the schools. The federal law says as soon as possible. I don't know of any state law that lays out a timeline to go in, but there are lots of state VR agencies that have, as a matter of policy, you can't go in until the senior year. You can't go in until you know, you're invited into an IEP. As Rich said, by good practice would say go in early, at least 2 years, to help do some of the transition planning issues. So you have some of those issues. Again, the cooperative agreement format that I talked about that some states have put in place. I know Nevada is putting one of those in place. A number of states have it. There also are policy issues around whether VR will support sending somebody to college, or sending somebody to college out of state, right? You have a lot of your fiscal issues that then get driven by ability to benefit. It gets driven by cost sharing requirements that are policy, that tend to be allowable under the federal policy. Then the states have to, draw their lines and make things work. And then another one that I like in terms of a state level policy is where you're starting to see, just as I shared about the federal law, you're starting to see states embed in their own statutes requirements for work-based learning experiences. Got to find my arrow here. There we go. So what are some of the implications for the guideposts? Let me start off this by saying, and to reiterate what Rich said, the guideposts were really developed based on 30 years of experience across the board, not just in the disability arena, but in the workforce arena, in the school-to-work arena, but really based on research, research findings, and a lot of demonstration projects. It's not the same level research, gold standard research that we talk about today. There's certainly been an evolution there, but it was certainly research-based. The guideposts are basically a decade old now. They've been used in a number of places. A lot of conferences have been planned around the guideposts. Several state-level strategic plans have been developed around the guideposts. IEPs have been designed around the guideposts. There are other places you're going to hear about in a little bit where the guideposts have been used too. But the guideposts really are a framework to be used, and we are literally, as Rich indicated, we are in the midst of trying to update the guideposts. There's been particularly in the last 5 years, and again, the guideposts, remember, were built on what all young people need, and then what are the extra subset of things that youth with disabilities need. So this isn't just, the guideposts aren't just about disability. There's a subset of issues, additional accommodations, additional kinds of supports that are built into the guideposts. So there's been a lot of research lately in the opportunity youth arena, in disconnected youth arena, in the mental health arena, in the youth development arena, all kinds of places where there's a lot of new research coming out. And as there have been a handful of studies, Rich has been involved in most of them, that have actually evaluated the effectiveness of using the guidepost framework. So there's only a little bit of a research base about the guideposts themselves. What is this one?
I think we're looking here to see what advice you have for VR practitioners when implementing policies related to guideposts.
Yeah, thanks, Joanne. I think, this is where, the first and foremost is doing things like this particular webinar, right? People have to learn about them. I go out and talk about the guideposts all over the place, and, there's always a lot of turnover in the different organizations, the different agencies. First we need education. We need to build in-service training. The VR in-service training programs need to highlight this. I know that in the Southeast, the TASTE Center down there has spent a lot of time helping folks understand how to use the guideposts in the VR system. We also need to be building it into the pre-service training. In fact, I just got notice the other day that there's a book being put out by the University of Utah that's a textbook for VR counselors that's going to have the guideposts built in it. We need more of those sorts of things. We need to create more tools, more implementation tools. And we need to, which is what this webinar is about, we need to really establish a bigger, deeper research base, which is Rich's job. Again, not to be too redundant, but the guideposts really are a mechanism for a framework, if you will, a lens, whatever word you want to use, to make sure you're taking a look at the whole young person, not just at one piece of it. It doesn't work anymore to just say, I only zero in on jobs, because there's so much more that comes with a job and so much more you need in order to keep and maintain a job that comes into play. So that really is how to look at the whole young person. So you can develop checklists of things that you can do here. You can identify, do what we call resource mapping to figure out where else in your community, there are things that come into play, or where somebody's already doing the, building of self-esteem, or doing the mentoring. So you need to learn where those are so that you can help pull the, maximize the resources and collaboration. We clearly need to do a lot more professional development in the rehab system and in the community rehabilitation programs, frankly, so that folks are using the guideposts properly. We also think that people need to be learning from their peers, which is part of what this is about today. Is you're gonna hear from Laura, and then there are lots of tools that already exist. We know we need to create some more, and we hope that people will tell us the kinds of tools that they think they need that could be helpful. And I think with that, I should be turning this over now to somebody else.
Well, thank you very much, Curtis, for that comprehensive policy perspective. Now we'd like to hear how state VR agencies have used the guideposts to support transition youth with disabilities to increase employment outcomes. So for that, we'll turn to Laura Spears, the Transition Services Coordinator at South Carolina VR Department. Laura, will you take it away?
I sure will. Thank you so much. And I will tell you, in South Carolina, we did exactly what Curtis recommended in the advice for using it as a framework. And that's exactly what we've done, is we have taken this framework, and this is how we are defining, developing, and tracking our services throughout the state. I had the opportunity to assist with an article that is posted on the NCWD website that clearly outlines how we've used the guidepost in South Carolina, so folks watching this webcast can click on that link and they'll be able to see a little more in-depth information how we are using it. We started with the guidepost in 2005, right when they were created. We started our very first high school high-tech program in 2005. We really took a lot of information from Florida, and they were instrumental in helping us get that program kicked off. So in looking at all of the resources they used for their high school high-tech programs, one of them was an activity guide that used the guidepost for success. And what they did was they coordinated and they organized different activities based on that particular guidepost. So if it was something career exploration-wise, that would maybe go under the preparatory experiences. And I've also put a link for that actual guide that was created by Able Trust in Florida. So what we did was in looking at that guide, because one of the things we do ask our counselors to do while they're in the schools, whether they're a high school high-tech counselor, just a regular transition counselor, we're asking them to provide these activities to the students in a group setting to help to get them ready for work. And in South Carolina, we do start at age 16, but we can start as early as 14. South Carolina law has it that transition services in the schools start at age 13. So we are able to, on occasion, especially if a student might be in danger of dropping out or just really needs that additional support, to start earlier than age 16, but we are starting at age 16 generally. So this is giving us time to get to know the student, to provide these activities that might maybe take 20, 30 minutes, and there's not many teachers who don't want us coming in their classroom. They enjoy us going into the classroom and maybe even coordinating some of the efforts of some of the curriculum that they're using to help their students get ready for work. So that's how we started with the guidepost. Then we took it a step further. In 2007, we got a 5-year transition demonstration grant to fund a youth employment services program in 4 sites. And truly the whole purpose of this grant was to really prove the value of work experiences. And as Rich has alluded to earlier, it really is by far the best predictor of post-employment success. And we've seen it time and time and again. With this particular grant over the 5-year period, these counselors must do monthly activities with the students, and every student must complete at least one work experience prior to leaving school. We developed a student profile sheet to collect information that not just only encompassed their work values or interests, but we were looking at personal and social information to put everything together to get their strengths and interests in place so we could help them figure out really what road they wanted to go down. The 5 years was so successful that we still have 2 sites that have maintained this particular program in their schools. And like I said, all of those students have to get at least 1 work experience prior to leaving school, as well as we're really encouraging all of our counselors to do those work experiences. How else we've incorporated the Guidepost into all of our services? Again, we are looking at just different activities to increase their career awareness and role models. So it may be, obviously we just had Disability Mentoring Day in honor of the National Disability Employment Awareness Month in October. So we have students out job shadowing and learning about the particular jobs that they have an interest in, getting them linked up with mentors, and doing service learning. In South Carolina, we are still one of 3 states that only has 1 track to recognized high school diploma by employers. We still have several school districts using what's called an occupational credential. In order to receive that credential, they have to complete so many work hours in a work type experience. So we are able to partner with those schools and link those students with those opportunities. So not only are they getting the benefit of a work experience, but they're earning some credits towards their occupational credential. We do a lot of the soft skills with those group activities. Again, anything that's going to get the student better prepared. If anything, I've given the counselors probably more information than they needed. We have so much curriculum that we're using. We actually have a project going on right now. We have a program, our Professional Leadership Development Program, and we have several counselors that are working with me to organize those particular activities based on the Guidepost, based on some of the changes we're seeing with WIOA. But if a counselor just needs to know what activity would I use for this particular situation, we'll have a nice go-to guide that they'll be able to do that. We're, of course, promoting self-advocacy and leadership skills. That's part of the activities that we provide the students, but we also have our Youth Leadership Forum that I do chair. So every summer, that's an opportunity for students to come in and really learn about self-advocacy and to develop some good leadership skills. One of the things I don't have listed here in the part of that family support is this past summer I had a training for all of the transition counselors, and part of that involved family engagement and had parents come in and talk about what are their expectations and how can we really connect better with the parents. And every office has to do a family engagement activity by the end of the school year that may be bringing parents in to meet with a community work incentives coordinator if their child is on Social Security benefits, so they can learn what's in store for them when they go to work. We also may have other resources, community agency partners come in, but we're again finding ways to pull in the parents and the families through those activities. Here I've got a slide aligning the VR services with the Guideposts, and if I can have the Excel spreadsheet pulled up, that would be great. Thank you. What we did was we looked at the Guideposts and we looked at the services that we provide, and we've kind of plugged in where do we think each of those services fits in. So for example, under the preparatory experiences, that's where our career exploration. It says ACE assessment. We have career specialists. They are our assessment and career evaluation specialists. Our counselors can actually also pull that information. We will use a lot of what the school is already doing, again aligning, as Rich said, the work experiences, what they're already getting in school. So we don't duplicate and test these poor students to death. So we're already looking at existing information, whether they're going out on field trips to learn about some of their post-secondary opportunities, bringing in guest speakers. So those things would fall under the preparatory experiences. Again, the work experiences, any type of the community-based type work experiences that we're providing, whether it's internships, job shadowing, visits actually to a site, to an employer to see what particular jobs may be out there, and also even linking our students with part-time jobs so they can begin getting some great work experience again before they leave school. Looking at the personal development and leadership, we looked at what are we providing that could fall under those particular things, and again, you know, whether it's some self-advocacy type activities, that's what we're looking at. The connecting activities is a lot of the services that we are providing. South Carolina is still very rare in that we do not contract any of our services out, so we don't use CRPs. We do everything in-house. So if we have a need for a student to be seen by one of our rehabilitation engineers for some assistive technology, that's where that would fall under. Also making sure that they are linked with any community resources such as mental health if they need some of those particular services. And then finally, the family involvement, making sure that we are really working with that family, the parents, the folks who really know what these students need, and making sure they're a part of all of those services that we provide in that very important process. So that's how we have tied in all of our services with the Guidepost, again, using that framework. If we can go back to the slide. Great, thank you. How we are using this, all of our new transition counselors, I do quarterly trainings for all new counselors. I call it Transition 101. They learn about the Guideposts, they're given all the materials that they need, and really starting to set the stage for using that framework. In our case note documentation, we actually have a subject line that you use that says Guidepost activity. So when you are providing an activity to a student, I can pull up and do a query and see, you know, how many different activities we're doing out there, again, and showing how we're tying that in with the Guidepost for Success. We have just recently restructured our IPE, and each Guidepost will be included on a student's IPE. So that's how our services will fall under there. Again, providing those counselors with that framework, so again, we can make sure that these students are receiving the right services in each of those areas so they can be successful. And that's it in a nutshell in South Carolina. It's been pretty simple. It's been actually very helpful, and it's been nice to see the progression now to where we can actually use it on the IPE. And it is also indicated in our MOAs with the school districts that we are using that, so the schools are aware of that particular practice. And what's nice is it does have the evidence to follow it to show that it is very successful.
Well, thank you very much, Laura. That's really great to get that real-world experience that you've been experiencing. So now we will turn to the topic of practice guidelines. A previous webinar focused on the potential application of practice guidelines in voc rehab service delivery. So we'll pick up that discussion here, and I want to turn to our presenters. Do you believe that practice guidelines or written guides would be a helpful tool for VR practitioners to support them in deepening and defining the application of Guideposts for Success to support the employment of transition youth with disabilities? And if so, what may be the benefits of having practice guidelines? Rich, would you like to start off our discussion from a researcher's perspective?
Yes, thank you, Joanne. One of the values, maybe I should say the value of the Guideposts are that they do serve as a framework for optimum transition practice because they are based in research, and that they aren't just something that just people have, to say it in the colloquial, pulled something out of the hat. This is science, the best we have it available at this point, applied to practice. So the kind of thing we often see in practice that Curtis alluded to, where there is a culture or a myth around a certain practice, but nothing that really supports it in research, is just the way things have been done. We can apply the Guidepost as a way of leading people in a better direction and have better outcomes. So as an optimal framework, they're great. They also point to, because they are research-based, they'll point to those kinds of interventions that will most likely lead to post-secondary employment success for youth. So that there are certain things that counselors can do and learn to do that will result in better outcomes for the youth and consequently better outcomes for the money that's spent and time spent in VR services for youth.
Thank you, Rich. Curtis, what is your perspective?
So the guideposts really are a standard of practice. We spend a lot of time here at the Institute for Educational Leadership thinking about standards of practice and trying to build them in a way that makes sense based on research as we're synthesizing it. And you know, so to that extent, I think the framework itself really does provide some guidance for folks in the field, VR in this case, to be able to practice. You know, we see them being used as a way to get people around a table and figure out where, you know, what needs to get done around a young person's needs. We have been talking about the guideposts themselves, but we've taken the guideposts and created some guides that we'll talk about a little bit later. But we have guideposts, the general guideposts, but we also have gone deeper in two different systems in two different disability categories. That being the foster care system and youth involved in the juvenile justice system, as well as going deeper around youth with mental health needs and youth with learning disabilities. We have two others that we're still struggling to try to help pull together and complete, one being that around young people who have truly most significant disabilities, and then the other one around how families can turn the guideposts on their side and be able to use them as well. So addition to that, other standards of practice that we think are helpful is what we call sort of building the capacity of people who work directly with youth, i.e. VR counselors and caseworkers, developmental disability caseworkers, community rehabilitation programs to improve their standards, and we have a whole study guide aimed at that as well. And as you know, as I mentioned earlier, there's also some resource mapping, and we actually have a tool that we've created for folks to do the resource mapping, right? The South Carolina instrument that you just saw is a really good example of how VR folks can take these standards of practice and sort through both what it is they're able to do, but also with some resource mapping where you can leverage and blend and braid other resources.
Well, thank you very much. Laura, is there anything that you would like to add?
I will echo, it does provide a wonderful framework. I think it just makes things visual, and a lot of folks are very visual and want to see what it is that they need to provide. And it also does broaden the scope of possibilities for students. We're making sure that nothing is getting left out. And I will echo on the different types of guideposts that Curtis was mentioning. Not only do I get to be the transition services coordinator, but I also work very closely with our Department of Juvenile Justice and providing services to those students in the system. And I am getting ready to do a training with their personnel using the actual guidepost that is created specifically for that population. Again, it's just a nice visual, a nice framework, and I think it neatly ties everything together.
Well, thank you very much. Let's move on to another question in terms of what type of information should the guidelines include. Rich, what's your perspective on this one?
Well, off the top of my head, the first thing they should include, everything that it does include should be based on available evidence about what works. So it's apt that we're doing this session for the Knowledge Translation Center because what I mean is let's translate the knowledge we have into practice. So reiterating some of the things I've said earlier, the suggestion about the guidepost and subsequent research, even though, as Curtis mentioned, it's limited, but the research we do have suggests that the guide should include how and why VR counselors should open cases well before school exit, because that does result in more successful case closures. It should include how and why you can collaborate with education and other community partners, because this collaboration, especially when it's focused on not just the handoff but the outcomes, because that leads to more successful case closures. And what's been said several times during the course of this broadcast, work and job experience prior to school exit, to the extent that VR counselors can help make that happen, will result in better outcomes. And what I said earlier, not just any job, but jobs that are kind of influenced by what the youth wants and what the youth's preferences are and so forth, and how the family can best support that.
Well, thank you very much. Curtis, can you share with us your thought about the type of information to include in such a practice guideline?
So we here at the Collaborative have been pretty deliberate about the way we've approached developing the guides that are associated with each of the different guideposts that I mentioned earlier, because we aren't developing a guide here in our technical assistance centers just for one system or one organization, but more broadly, because transition does take so much collaboration across systems and across partners, different partnering organizations. So we've really tried to kind of zero in initially on laying out common definitions, try to get people in the same place around common language. I mean, people in the generic WIA or workforce development system, have no idea what a community rehabilitation program is, for example. So, we spend the sort of first chapters or so trying to get people grounded in common language, common population definitions, and those sorts of things. Then we take the guideposts themselves and try to lay them out in a way that addresses the sub-population issues, right? Like a student who has been kicked out of school and gotten involved in the juvenile justice system, it may not be the best thing to send that kid back to the very same school. So there's an extra set of things you need to think about. Or in the foster care system, how records transfer from one place to another, right? An extra set of things you have to think about. So we try to do that. And then we go deeper in subsequent chapters to try to lay out, go into the individual elements within the categories, try to come up with examples that we found from our research, and then build, hopefully identify some tools and or create some tools, share some tools, because there's a lot out there that's been done over the years, and so our guides tend to try to share those kinds of tools. And then of course we oftentimes will have a whole set of recommendations for additional professional development, additional research, and certainly additional changes that need to be made to policy.
Thank you. Laura, let's hear from you now. What's your perspective on the type of information to be included in the guidelines?
I certainly echo everything that both Rich and Curtis said, but something very simple and easy to follow. That's me. I'm pretty much a simple person. Something maybe with examples of how they can be utilized. Of course, the foundation for where this came from, how it supports, and of course, I think if folks can really see the outcome measures, they see where the rubber meets the road, that when these things happen, that this is the success that can happen.
Well, thank you much. Let's move on then to another question. Who should be involved in developing the practice guidelines? Rich, will you give us your thoughts?
Well, basically anybody who knows what the guideposts are and have some working knowledge of their applicability to VR service. And so, there's a list here on the slide. Basically anybody who might have an input would include researchers, the counselors, state VR staff, transition coordinators from the school system, employers, and especially transitioning youth with disabilities and their family members. Each of these groups represents stakeholders in the transition process. Those same people should be involved in developing these kind of practice guidelines, assuming, of course, that they have some basic knowledge of what the guideposts are.
Well, thank you. Let's move on again to Curtis and get your thoughts on this.
So for us, it really is about casting a really wide net of to capture the the breadth of stakeholders that really need to be involved. And as we did the initial guideposts, we really had more than 50 or about 50 different national organizations, mostly national organizations, some state organizations that were involved in this, that represented special ed, vocational rehabilitation, counselors, school counselors, legislative, policymakers, and we had youth and we had family members themselves. So this had a lot of input when we put these together, and then each of the subsequent guidepost areas and the guides that we did, we then reached into those populations. So if we were doing the juvenile justice guide, we really made sure we had state level and local level. In some cases, we had probation officers. In other cases, we had state juvenile justice agencies, as well as researchers and policymakers at the federal, state, and local level. So, when you're doing these sorts of things, it really is important to see what's the target population, and make sure you've brought together all the stakeholders, including the dissenters.
Well, thank you very much. And now, Laura, let's move on to see what you might want to add about who should be involved in developing the practice guidelines.
Again, I'm so lucky I get to echo on Rich and Curtis, but folks who really, truly have that knowledge of the guideposts and where they came from. Any of our organizations, and I'd love to see even some employers weigh in on understanding and identifying some points that they could attribute to the guidepost. In South Carolina, I head up the Transition Alliance of South Carolina, which is an interagency collaboration, and we have many of our partners at the table on a statewide level. And now we've expanded and opened it up to our local levels. And as a matter of fact, next week we are meeting in Charleston, South Carolina, and we will have 34 local interagency teams made of folks serving this population. So we have school partners, VR partners, some of our disability and special needs partners, parents at the tables to start really focusing on what their particular needs are in their local community with relation to helping these students be successful when they get out of school. And the great thing is that we bring the guideposts to the table to help these teams to, again, make sure that they're covering everything that we may not think of covering.
Well, thank you very much, and that concludes our discussion for the day. We really appreciate the input from all of our presenters and discussants. I would like to ask if you have any closing comments that you'd like to make, and also if you could give us your contact information, and we'll make sure that this information is made available on the webcast page that we're developing for this webcast today. Rich?
Yes, Joanne, if anybody would like more information about the work of our Center on Transition to Employment and the research that supports some of the comments I made today, they can go to our website, which is transitiontoemployment.org. Again, transition to employment, all one word, all lowercase, transitiontoemployment.org.
Thanks. Curtis?
Thanks for convening this and giving us the opportunity to really help folks in the VR system understand the guideposts and their applicability to their work. You can visit our website at www.ncwd-youth.info. find the additional materials and guides that we've talked about. And I would particularly encourage folks to give us some thoughts and input as they dig deeper into the guideposts. As I mentioned, we're in the midst of updating them, and we're definitely looking for input. Anybody wants to reach me, you can email me at richards, RICHARDSC, @IEL.org. Thanks again, Joanne.
Well, thank you. And Laura, let's get your contact info.
Okay. And I certainly welcome anyone who's interested in learning how we use the Guideposts in South Carolina. Contact me. It is lspears, S-P-E-A-R-S, at SCVRD, which stands for South Carolina Vocational Rehabilitation Department, .sc.us.
Okay, well, thank you very much, everyone. I also want to remind everyone that today's event is one of a series of webcasts on knowledge translation from vocational rehabilitation research to service delivery. We intend that these webcasts will foster the development of a community of practice where this dialogue among researchers, educators, practitioners, policymakers, and other stakeholders can continue to inform and serve those dedicated to vocational rehabilitation and its goals. To stimulate more discussion, we invite listeners to provide your input on today's webcast and to share your thoughts on future webcast topics and to participate in the community of practice to continue the dialogue. We'd like to hear from you because your views can inform and shape our future work. You can contact us at the email address here on the screen, which is ktdrr@sedl.org. We'd also appreciate your input about the webcast by completing a brief online evaluation form. The link is here on the last page of the PowerPoint file, and everyone who registered for the webcast will also get an email with the link to the evaluation form. Once again, I want to thank our presenters for being here today and thank Cindy Kai and her colleagues at AIR from all the staff here at the KTDRR. We also appreciate the support from NIDR to carry out the webcast and other activities. On this final note, I'd like to conclude the webcast. We look forward to your participation in our next event. Thank you.